Stay tuned for the Bulldozer Health Show, brought to you by Bulldozer Health Incorporated. The opinions stated on this show are not necessarily those of this station. All listeners should check with a trusted health advisor before following specific medical advice.
Hello, my name is Wendy Love Edge, and I'd like to welcome you to the Bulldozer Health Show. In this episode, I'll be discussing sexual health with Dr. Tammy Post, bioidentical hormone expert, author, speaker, show host of The Naked Doctor, and a family and functional medicine physician. Welcome to the show, Dr. Tammy.
Hi, thanks for having me here. I'm very excited today.
Me too. So, Dr. Tammy, it's been very nice working with you a little bit on the Bulldozer Health Project. Thank you so much for seeing patients in Arkansas. It's so exciting, an exciting time that cannabis is legal for medical reasons in Arkansas, and patients are starting to come for their evaluations. So, what are your thoughts about cannabis becoming legal in Arkansas and all the changes that are happening?
Well, it's so new. It's just every day is just something new, and I'm hearing tons of stories from people. I had no idea how much cannabis is medication, and from doing everything that I do has nerdy science behind it, and I don't do anything without understanding, which I think a lot of the doctors, I'm not bashing my colleagues, but I do that a lot. But I think that some of this, the fear that they have is because they just haven't done the research. I mean, I don't think most doctors even know there's an internal cannabinoid system. And I don't think they understand that, signing the certifications is basically just certifying that in your medical opinion, that person has that condition, not even that you approve of medical cannabis or that that person is indicated to have medical cannabis. You won't be prescribing cannabis, but they're still just terrified to even sign the letter saying that that person has that diagnosis. So I've heard a ton of stories. People are calling all over their primary care doctors, and they're getting so much resistance. And I kind of suspected that, being kind of the Bible Belt. I hoped that that wouldn't be true. When you look at the statistics with the AMA, they say over 50% of doctors approve of medical cannabis, but it's not the case in Arkansas, unfortunately, panning out to be, as I've seen. That could change. I think education like this is really important, and so I didn't intend to become the cannabis queen. I'm sort of the hormone queen. I didn't intend to be the cannabis queen, but it's kind of becoming that because no one else is stepping up and willing to do the research and understand the science to do it.
Thank you so much for providing some access to low-income patients and really to all patients in Arkansas, because as you pointed out, it's challenging to find physicians that will write the recommendations. And so you are much appreciated. Thank you. So this show is actually about sexual health, though, and so I wanted to ask a little bit about cannabis and sexuality. And I've read articles where they talk about it as an aphrodisiac and an enhancer for sex. What are your thoughts about cannabis in that way?
Well, I think one of the nice things about many of the cannabinoids, if you want to think about medical cannabis as a medicine, the way it works in the brain, many of the cannabinoids, sort of, I don't want to compare it to alcohol because it's a totally different beast, but just like with alcohol, when your inhibitions are lowered and you're not so self-conscious about the way you look, and if you got cellulite on your thighs, I think that when you're just more, especially with THC as a cannabinoid, the psychoactive, component of that tends to make people a little bit more jolly and connected and, more sociable. So I think in that, you're not so self-aware. And I think that one of the things, as I work with patients with sexual health, one of the biggest things is, testosterone decline, of course, with age alone. And so, yes, there are some studies that may kind of be on the fence about whether it lowers testosterone. I think probably in the patients that I've seen it does. So just anecdotally, I can't really speak to the research so much, but just having your inhibitions lowered just a little bit. And I think one of the things with reefer madness that they were scared about cannabis was that teenagers would just be like wild rabbits without discernment, having sex with everybody all over the place. It doesn't make you lose your discernment. It just makes you maybe not so self-conscious about your flaws. And, I think men and women look at each other very different sexually. And that men tend to see like a silhouette or an outline. Women, we focus on every little flaw. I was joking about, getting a pimple before the show this morning. You guys didn't even see it, but I'm thinking it. In my mind, I'm imagining it being absolutely huge. So, and I don't use medical cannabis, but if I did, I might not be so concerned about that.
Right,
so,
you wouldn't be as worried about it.
When you're in more of that social setting, even with your mate, I think as an aphrodisiac, I just think when someone has confidence, they are more attractive. And so if you're not self-aware or self-conscious, I think you're going to be more attractive, which I think in it indirectly might be that aphrodisiac. I don't know specifically that it's triggering parts of the brain. However, there is a hormone called oxytocin, which is the trust, love, cuddle hormone. It's actually the hormone that my husband and I met around because he had a company that actually produced an oxytocin nasal spray and a sublingual. And so that spray is actually, the oxytocin is actually released when you do THC or you do something that feels good, or when your pain is relieved, or when you snuggle or cuddle an animal, or when you have a 20-second hug, or just make eye contact with somebody that you like. So oxytocin is the anti-cortisol, anti-stress hormone. So, as far as an aphrodisiac, oxytocin can actually encourage the connection. I don't know so much about the sexual connection, but, it's not just about, I always tell my patients, it's not just about the sex, it's also about the relationship, the intimacy, and the connection. And most of the research, I don't want to quote statistics, but most of the research says that 1 in 4 couples over the age of 40 are not intimate anymore. And that's not even talking about sex. That's just talking about intimate relationship. Intimacy. And that's just, sad that the longer we're in relationship with people, the more common it is to lose that intimacy and that connection. So the oxytocin is powerful, and I think that could be significant.
Wow. So you're known as kind of the hormone queen, right? And so I wanted to ask you some questions about bioidentical hormones.
Sure.
First of all, what does that term mean, and then how does that relate to sexuality?
When I think of bioidentical, you hear a lot of different things. The easiest things that I tell my patients, it is, if you ever took any organic chemistry and you ever looked at a structure that has a hydrogen or an oxygen ring, or just that structure, that is exactly what your body uses. And I think it's so interesting. I'll just digress a little bit about hormones. People don't realize that just like hormones, you have internal hormones that drive every process in your body, not just your male and female hormones, but that drive hunger, that drive your metabolism, that drive every process, sleep, your cholesterol. It drives every process. So just like you have an internal hormone system, you can take external plant hormones. Just like we have an internal cannabinoid system, you can take external plant cannabinoids. So when we take, the cannabinoids that are in the cannabis plant, they are bioidentical to our internal cannabinoid system. So when you have hormones, if you get them from a pharmaceutical company that has tweaked them and added hydrogen, oxygen molecules so that they can patent them and make more money off of those prescriptions, those are what we call synthetic hormones. And just like Marinol is a synthetic THC, it doesn't quite do the same thing that all the cannabinoids can do in our system. Hormones are the same way. So we extract hormones from a plant base that are chemically the same as our own human structure. And so the problem is that there is a balance to that. And just like I like to compare these two because now they've become kind of a good learning analogy to me, that just like there are many different cannabinoids that treat many different things, if you have a deficiency in, say, progesterone or cortisol or DHEA or pregnenolone, it's not just about estrogen. People hear hormones, they think estrogen, they think breast cancer, they get shut down. And all of the scare that came around estrogen was around synthetic estrogen that is the proliferative estrogen that's fine if you're a 9-year-old girl trying to grow breasts, but if you're a menopausal female, you don't want the proliferative estrogen in excess, and you certainly don't want a synthetic estrogen that acts like that in your body. And there are many pesticides and different things that we call them xenoestrogens in different things that can act like estrogen in the body. So we environmentally have completely changed our hormone structure and makeup, and I see more and more people having problems, especially around menopause or what we call andropause in men, as their hormones start to decline. And it's not just estrogen, it's all the different sex steroid hormones that can decline. And that's probably why we're seeing the drop in intimacy, the drop in relationship, because everybody just doesn't care anymore. But it also affects, I always say there's two kinds of hormones, fat burning and fat storing. And so the fat storing hormones are cortisol, insulin, and estrogen. So if you have imbalances in your estrogen system, you will gain weight. And I see women after menopause gaining 5 to 15 pounds a year, and they've really not changed anything different. So if you want to be metabolically well, you have to have that hormone balance.
Right. And so part of your practice, you're checking people's hormone levels, I assume. And if a patient comes to you and they explain to you that they're having some sexual dysfunction or trouble with libido or achieving orgasm, is that your go-to to look at the hormones? Is that the first step, do you think?
Absolutely. I also look at their nutrition, because if they're eating foods that are inflammatory foods that are causing inflammation in their body, they've got a huge amount of cortisol that's going to throw everything out of balance. So you really have to look at them holistically. So it's not just hormones, it's a very holistic picture of, are you taking care of yourself? Are you eating right? Are you eating a bunch of sugar and junk that's, making your insulin crash? You're tired, you don't feel like being intimate because you're just tired and you've given everything you have at work that day, and now there's nothing left over. So all of that, multifactorial. Of course, I also love stem cell therapy. I know you're interested in that as well.
So you mentioned erectile dysfunction for not only men. We hear all the time in the news, about Viagra and about male erectile dysfunction, but that's also an issue for women, isn't it?
Absolutely. And there are two things that are really easy. Again, I'm not dispensing medical advice, but these are supplements that people can get. And usually with women, women don't, because doctors don't have these conversations about checking different levels and knowing what is optimal levels. It's one thing to check levels, and then knowing what to do about it, or optimal is another thing. But DHEA and niacin, which is a B vitamin, are huge for blood flow to those areas. And what I find is a lot of people, when they come to me, they're on a ton of medications, and specifically antidepressants, blood pressure medications, and cholesterol medications all affect your hormone balance, and they'll be on these and can affect their libido and ability to have erection. And nobody's ever told them that taking Prozac for 10 years will, decrease your libido. They just think that, something's wrong with them, or it's a part of the depression. And there are medications, I'm not telling you to stop your medications or not take them, but there are medications that have less of those side effects, and everyone's different, and the way they metabolize those medications is different. So it's just a conversation, but it's an empowered conversation on your end. Unfortunately, you're going to have to be the, educated healthcare consumer, because the way our system is set up, as you know, which is your voice and your, what you're trying to change with Bulldozer Health, is that doctors just don't take the time, and we're marketed to by these pretty little drug reps who come in, and these, pharmaceutical companies and the insurance companies that just drive this wheel. We don't stand a chance. I had the best of intentions coming out of med school, and I ended up at one point just like all my colleagues until I had my own issues and I had to get outside the box to fix myself. Then, then I started looking at alternatives.
And you mentioned several things also that I think are really key between doctor and patient relationship, talking about lifestyle issues, all of those things that I would love all physicians to talk to their patients about, because they definitely impact. We're talking about sexual health today. It impacts that, but it impacts every area of people's lives,
Absolutely.
And pharmaceuticals, they have their place, right?
Sure, absolutely.
But really doing your own research and having that doctor-patient relationship, like it sounds like you have with your patients, so you can discuss it and know all the ins and outs.
The Food and Drug Administration on their own website states that a drug is a prescription when a medical professional is required to supervise its use because the patient cannot safely use the drug on their own. Why then are drug companies allowed to market directly to the patient? This puts Americans' health at risk every day. Let's fight back and get this public health risk off of television.
So I wanted to talk a little more about the sexual issues, because people, especially women, I think, tend to think that, you have to be perimenopausal or menopausal to have these libido issues or erectile issues or all of that. But do you see wide age ranges, and are people willing to open up about it and talk to you?
Well, they do me, because I think, like you say, like I have a relationship with them and I help them to feel safe, and I'm not rushing them, because it's not a rushed conversation. If you don't feel safe and comfortable, and like your doctor is very professional yet caring, then you're probably never going to broach that. But one of the issues is that with the young females, birth control actually suppresses the whole HPA axis. So if you were to check estrogen and testosterone and progesterone levels in a young girl on birth control, they're almost zero, and that's the way it keeps them from getting pregnant. It suppresses their natural hormone production. So if you don't have testosterone, your libido is going to be lowered. And some people would say, well, that's great for your promiscuous teenagers running around. We don't want them, having high libidos or whatever. But I think that as human creatures, we are meant to enjoy that aspect of our lives. And so, what happens is, we get into our 20s and 30s, and women don't know any different, and then they're on birth control, their hormones are suppressed, now they get depressed or they get anxious. Just through experience, I think that we just make so many little compromises, especially as women, that, we go to our doctors, and if you do work up the nerve to say, oh my gosh, I have no libido and my husband is gonna leave me if I, don't do something different, they're like, well, just take one for the team, or or they'll be like, well, there's only Viagra for men, or women just don't feel comfortable having the conversation. And a lot of doctors are men, so a female's probably not always going to feel real comfortable with a male doctor having that conversation either, unless they're very professional and they feel really comfortable with the relationship.
Right. And what about other relationships where same-sex couples? Are you seeing the same types of issues with hormones and intimacy?
I think that there's so much judgment against homosexuality that we think that, I think a lot of the 80s and, kind of the AIDS pictures and sort of the clubs out in New York and San Francisco really hypersexualized the homosexual relationship. But I would, and I can't speak personally, but from the patients I've talked to, it is more about relationship than it is anything about the sex. So it's very common in same-sex relationships as well to have those exact same challenges. And in fact, a lot of times, I'm not sure what the research is on this, but a lot of times in same-sex relationships, and in any relationship, good grief, sexual abuse is huge in people's past. Right. And so you bring that to the table, and you bring old trauma, and anything around any kind of intimacy could potentially trigger old traumas. So, unless you have a really healthy, you've really worked a lot on, and healing and being in that better place. I think the biggest sex organ in the body is the brain. And, you can, you really, if you don't have that intimacy, or you have your amygdala triggered every time you even think about getting intimate, even on an unconscious level, you can really have a lot of challenges. And
sure. And that doesn't matter, what type of relationship it is, same-sex, heterosexual, it doesn't matter. Same issues, right?
Yeah. I always tell people, if they don't believe in the mind-body connection, you think about an erection. Erection is a thought that then triggers a physiological hormonal chemical response, right? So if you don't believe in the mind-body connection, you've never seen an erection. So just the very fact, if we're talking about sexual health, it's very connected. You have to have the thought first. You have to have the hormonal chemical reaction. And so a lot of times the emotional is not really addressed. So the doctor just wants to give Viagra, which is easy because it increases the blood flow, but it's not doing anything about the brain connection to those areas. And a lot of my patients, Viagra doesn't work for that very reason, or if their testosterone is low. I would say probably 9 out of 10, if I had to guess, women that come to me for holistic or hormone advice are on an antidepressant. I think a huge number of women and men, but women are on antidepressants. And so, the ability to have orgasm is really limited on those medications.
Right. And are you able to offer them some alternatives?
Yeah. Absolutely. So a lot of times, low-grade depression is often hormonal, female hormones, or male hormones, or it's thyroid, or even just low vitamin D levels. Seasonal affective disorder is, now we know that that's from low vitamin D levels. Low B12 levels are huge. So nutritionally, we're seeing people that are just tired and depressed, and then or not sleeping, and then or they're eating sugar and it's causing insulin spikes and things like that. So anxiety and depression are two of the most fixable conditions if you know the question behind the question or the underlying cause.
So just to switch gears a little bit and talk a little more about stress and cortisol, because I know that cortisol causes so many issues in the body, and how does that affect the same, sexual issues that we've been talking about?
So we talk about emotional stress with libido and sexual interest and things like that. That's the kind of the last thing on the table when you have so much life happening sometimes. The adrenal glands don't know whether you're being chased by a bear or whether you're taking, crop-dusted pesticides into your body. Stress is the same with your adrenal glands. So your cortisol is your body's natural anti-inflammatory. I like to say it's the universe's aspirin to our physical structure, right? So you have inflammation, you have pain, you have stress, you have emotional stress. The adrenals pump out cortisol. The brain makes some of the cortisol too, but you pump out that cortisol. And oxytocin is the yin to the yang of cortisol. So if you're not getting cuddling, if you're not getting relationship, if you're not getting, your needs met emotionally, then you don't have that oxytocin response to calm that cortisol. And a lot of people do things that can be destructive, like turn to drugs, any kind of drug. I'm not saying that even alcohol is a drug, nicotine is a drug. I'm not saying those are necessarily, right. I'm not judging them. I'm just saying that they're trying to get a need met. And so some of those things can be not always helpful to the body, like, nicotine or alcohol. Sometimes people overeat because food can be like a drug. It causes that oxytocin response. It's a self-soothing, calming response. And so if you are in a place, I believe, where you can emotionally process and laugh, or just have, a funny thought about something, or, just zoom out and go, is this really true? Is this really life or death? Is this really going to kill me? I believe that thoughts become emotions, become hormonal chemical changes. So if you can meditate, or you can control the thought, or you can eat healthy, or get the supplements or vitamins into your body that help you think better thoughts, then you can have a hormonal change that can really affect that. But if your body is constantly under stress, whether it's inflammation or emotional, and you're pumping out cortisol, of course it causes belly fat, because all the toxins have to go somewhere, because they would kill you if they hit your internal organs. So you'll upregulate belly fat, you'll have distorted thinking, so your relationships are all going to be really confused, because it's going to be, you're not even thinking straight. When you've been really stressed and you get in a fight or something, you don't even make sense.
Right, and it affects everything. So recently I went to see, I have some heart issues that are long-term. I've been stents in my heart and had angioplasty about 1.5 years ago, despite all the positive health changes, And so I had reduced the amount of cannabis that I was using, because I was reading that it might negatively be affecting my heart. And so I didn't call the cardiologist, I just made these changes. And the anxiety and everything increased,
Yeah.
So I went to see my cardiologist, and he actually said, you are not using enough cannabis. The cortisol levels are increasing. I can see you're gaining some weight.
Yes.
Wendy, go home and go back to your other routine where you were using this medicine more frequently.
Yes.
And so it was very exciting to me to have a physician actually tell me that. And he wrote it in his note. My primary care got a copy of it. And she said, this is the first time I've seen a physician actually write this in their notes. So what are your thoughts about that? Coming full circle back to the cannabis with cortisol and...
Yeah, everyone knows that, I'll just say, cantankerous old man that lives into his 90s, who smoked like a chimney and ate, country food and butter biscuits and lived till his 90s just to give everybody hell. We all know those people. So I believe that the mind and the body connection is very powerful. And if your thoughts, if you think something's bad, if you smoke a cigarette and every time you smoke it, you're saying, oh, this is so bad for me. I know this is killing me. I know this is causing lung cancer. Thoughts become things. Now that cantankerous old farmer, he don't care. He's like, I like it. I don't care. I like the buttered biscuits. He's fine. Now, I'm not, of course, as a medical professional, I'm not saying those are good things. But I am saying that how you think about things, and the same thing with stress. That's why I say laughing or having fun, or, you know, I mean, you can be under the worst circumstances, but if you're in relationship with somebody that you can just laugh and go, you know what, nobody's going to die, it's going to be okay. It just goes such a long way. So the answer, a very long answer to your very short question, was if the cannabis works for your anxiety, the worst thing that you can do is have heightened anxiety, heightened cortisol levels that are just melting your heart and your brain. And I think that's probably old fears that are coming up, because every myth that we've ever busted about medical cannabis, all the way back to Nixon's regime, I like to say, because I think he was more of a dictator than he was a president. But everything that goes back to that reefer madness built in all this fear is still in our DNA. And so whenever we start thinking, you know, you would never have thought the doctor had you on blood pressure medication, which I'm not saying I believe in blood pressure medication or I don't, because I have different thoughts on that. But let's say your blood pressure was not controlled. You would never think, I think that medicine might not be good for me. I'm just going to wean back on that on my own. You would probably, you know, keep doing that. And I'm not saying you made the right or wrong decision, but I am saying that cannabis, and no aspect of that, as far as I've ever seen through all the research, has any deleterious effects. In fact, one of the biggest arguments is that people smoking it, because we know about nicotine in cigarettes causing lung cancer, the research actually says that there's no decrease in pulmonary function over 20 years of people studied with cannabis. So I would, if it's that way with the lungs, I would say it's that way with the heart. But I think that's probably old fears popping up in you going, well, maybe I should back off on it.
Right. It was really shocking for me, who's such a cannabis proponent, but, you know, it was my heart, right? So it's made me really think. I'm just following the cardiologist's advice now, and it sounds like your thoughts are in line.
Yeah.
So Dr. Tammy, thank you so much for joining me today. It's been a very interesting conversation. Do you have any last thoughts you'd like to add?
You know, I just think that it's just so important. Knowledge is power. That's what I always say. Just do your research. Don't take anybody's word for anything. Don't take anything I've said. You know, I mean, it's all good knowledge is power stuff, but you know, we have the age of the internet. It's all out there, and just use some discernment, some common sense, you know, whatever your version of God or the universe is, you know, and just, you know, get quiet, meditate, and do what resonates with you and feels right. I think you can't go wrong that way. But the problem, I think, is when we step into judgment and we judge things as good or bad or right or wrong. And, you know, just from the standpoint that the place we stand and how we view things is all just based on social and historical experience, not even evidence. So be careful where you're getting your information from is all I would say.
Bulldozer Health Incorporated is a 501c3 nonprofit organization and healthcare reform initiative. You can find us at bulldozerhealth.org. Take back your health, America.
Unexpectedly, she returns to me like a wave of pure euphoria that slowly washes over.